Thank you, Daniel, for the kind introduction. I'm very happy to see all of you here today. A very good morning to all. Thanks, Daniel, for livening up the situation again. I would like to thank Singapore Cancer Society for giving me this opportunity this morning to share on prostate cancer with everyone here. I hope this whole morning's talk on cancer is not too heavy early in the morning, but I always like to start off any talks on prostate cancer with a very simple fact, that prostate cancer is quite unique, and it's not exactly similar to a lot of what we have, our preconceived notions of cancer. Actually, patients with prostate cancer do perform quite well. But nonetheless, it is very prevalent, and that's why we need to know a little bit more about it, because it's very prevalent, and as you can tell, it's actually the third most common cancer amongst men in Singapore. So without further ado, I'm just going to go straight into the outline of my talk this morning. In the next few moments, I will touch on how common is prostate cancer, what are the risk factors, and perhaps go through some of the signs and symptoms that we might be expecting. And lastly, I'd like to discuss the diagnostic approach to prostate cancer. So how common exactly is prostate cancer? Now, I don't like to put up ugly pictures of cancers and tumors, but I hope everyone knows by now that we always liken the prostate to a walnut. Not exactly in terms of appearance, but exactly in terms of the size of it. We always like to tell them, oh, this is actually a male organ that sits under the bladder and is about the size of a walnut. So, as alluded to earlier, prostate cancer is the third most common cancer amongst men after lung and colorectal cancer. And this data is actually from our very robust Singapore Cancer Society registry. And actually is, in terms of cancer deaths, is responsible for being the sixth most common cause of cancer in Singapore. Now, what about globally? Now, globally, prostate cancer is the second most commonly occurring cancer in men, and actually the fourth most commonly occurring cancer overall. Now, it's estimated that there's at least 1.3 million new cases to be expected in the year 2018. So, the exact cause of prostate cancer remains unknown, but surely everybody, when it comes to any form of cancer, we always want to know what can we do about it. So what are the risk factors and how we can prevent them? So there are several risk factors associated with prostate cancer, and we'll just go into it in a short while. And I like to talk about risk factors in a very simple concept. So usually we divide it into things that are unmodifiable, factors such as age, family history, and ethnicity. These are the things that are not within our control. Essentially, we are born with these factors, and there's little that we can do about it. But it is important to know in terms of what is our risk profile for having such prostate cancer. And on the other group is environmental influences, risk factors, and perhaps, if you would like a more familiar classification, nature versus nurture. Prostate cancer is strongly associated with increasing age, and prostate cancer primarily inflicts older men. So prostate cancer is actually very rare in younger men, so don't get all too excited about prostate cancer when you're in your 30s and 40s, but the chance of having prostate cancer significantly rises after the age of 50. In fact, about 6 in 10 cases of prostate cancer are found in men over the age of 65. Again, we see the data that shows us that the risk of having prostate cancer significantly jumps after the age of 50. And this is actually the age group where we are most interested in terms of finding out a little bit more about your risk profile. So, family history. Family history, unfortunately, is something that we cannot run away from. It is actually in the genetic makeup of our human being. So, fortunately, it doesn't account for a large proportion of prostate cancer. In fact, only 9% of prostate cancer cases are truly hereditary in nature. And what makes you at higher risk? What is a significant family history? So if you have more than 3 affected relatives, or perhaps more than 2 relatives with cancer, prostate cancer diagnosed before the age of 55, that puts you at higher risk. Having a brother or father with prostate cancer also increases your risk by 2 to 3 times, actually. And what about females? Having a mother with breast cancer also increases your risk, interestingly, because of certain genetic mutations that are shared between breast cancer, ovarian cancer, and prostate cancer. So certainly a history of family prostate cancers or breast cancers do put you at a higher risk of having prostate cancer. Now, what about your race? Fortunately, Asians do not have a higher risk in the entire global map. Well, if you look at internationally, well, the highest risk is actually found in black males compared to white males or Asians. And specifically, African blacks have the they have the highest risk of having prostate cancer, and usually these are the more aggressive disease. So this is a plus point for being an Asian, I guess. So quickly moving on to what can we do about it? Enough of what we cannot do about it. I'm sure everyone is raring to go on what can I do to improve my chances of not having prostate cancer. So interestingly, population studies have been done and actually shows that Japanese men living in Japan have actually a very low risk of prostate cancer compared to the Caucasians living in America. But when they followed up the Japanese men who actually migrated to America, they actually found that they have a prostate cancer risk that approximates the Caucasians. So certainly, such an observation begs the question, there will be environmental risk factors that are at play here. So this again is a very strong evidence for lifestyle changes and things that can actually play a role in the development of prostate cancer. So I think we have heard a lot about obesity from our Prime Minister, and I think there is actually value in actually concentrating on why this is not good for us. Because studies have shown that there's actually a higher risk of advanced prostate cancer as well as more aggressive cancer developing in men who are obese. Now certainly this extends to the treatment. For example, treating obese men for prostate cancer also shows that there might be a higher chance of a poorer outcome. And obesity is usually is not an isolated problem, because when you're obese, it tends to generate other problems as well, such as hypertension as well as diabetes. And there's a phenomenon called a metabolic syndrome, and this has been well studied to be linked to a higher risk of prostate cancer as well. So if I can urge everyone, tackling obesity is helping to tackle your prostate cancer risk. Now, we've heard a lot about smoking this morning from Prof. Philip and Dr. David. So I think we cannot emphasize this fact more importantly. 20% of men do develop prostate cancer, and this is actually attributed to smoking. So the incidence and mortality actually increases significantly with the increased use of tobacco. Now, this is one of my favorite topics, diet. I think there's a lot of interest when it comes to how we can change our risk profile when it comes to modifying our diet. And you can see that there are only 4 vegetables and fruits that I've put up here. But in truth, I have been asked every possible fruit and food there is in our diet from A to Z, and from patients. They have actually gone through every fruit with me, and they asked, doctor, how about this fruit? How about this food? Is it going to help me? And, I've literally cycled through every fruit from A to Z. So the truth about diet is you can never go wrong. You can never go wrong with eating healthily. Be it prostate cancer, be it other forms of cancer, be it just diabetes or high blood pressure, you can never go wrong. So I think at the end of the day, while there are evidence to show that certain foods do help in reducing our risk of having prostate cancer, I'm sure everyone has heard about tomatoes, broccoli, pomegranates, fruit and fruits that are high in certain components, what we call antioxidants, such as polyphenols. The truth is, eating healthily helps you a lot more than just your prostate cancer risk. It helps you live longer. It helps you have a lower incidence of other chronic diseases. So I think we do not need to go into the nitty-gritty, because I'm sure you're not just interested in reducing your risk profile for prostate cancer, but for any cancer for that matter. So I will not go into the certain details of what food and what fruit to go. If not, the supermarkets will be having a huge crowd this afternoon. So let's just suffice to say that eating healthily, having a good share of fruits and vegetables will help you no matter what. Okay, look, so let's quickly move on to the signs and symptoms of prostate cancer. Fortunately or unfortunately, early prostate cancer is often silent, which means that there is nothing that will prompt you to come forward and have an earlier diagnosis. Now, very often, this is exactly the stage where we want to catch the prostate cancer. We want to catch them early, but in the early stage, you are unlikely to have any form of symptoms or signs. Now, a lot of my patients ask me, Doc, I've been having problems passing urine since 5 years ago. Was that the very first inkling that I had prostate cancer? Now, the truth is, urinary symptoms are more likely related to benign conditions of the prostate rather than prostate cancer, instead of prostate cancer. And for prostate cancer to actually evoke certain symptoms or signs, usually this is in a very late stage, and that is not the stage that we want to find out. So, but what are some of the symptoms that can arise from prostate cancer? And usually, as I mentioned, this is in a very advanced stage. You may have urinary symptoms, which may manifest as poor flow. You have irritation. You find yourself keep visiting the toilet in the day. You might even have some blood in the urine or even in the semen. In very advanced cases, you can have pain in the pelvis or in the area of the rectum. In stage 4 prostate cancer, you can actually have pain in the bones. Now, the bones are very common sites of spread when it comes to stage 4 prostate cancer. Usually, very often is the first site. And also, lastly, you can also experience some swelling of the lower legs. That can also present in a very late stage. So, moving on to diagnosis. How are we diagnosing prostate cancer in the 21st century? Now, I'm sure most men here are very familiar by now with PSA, okay? It's not part of Singapore Authority, okay? It is actually a blood test, a very simple blood test, and it often marks the very first starts of a prostate cancer patient's journey. So it is actually a blood test that is quite rampant and quite prevalent whenever you go for example, your routine health screening by your general practitioner or your family physician. And very often it is this abnormal blood test that prompts you to go down these routes of further investigations. Now, one thing to highlight about prostate-specific antigen. Now, if you do have an abnormal value, what does it mean? Now, prostate-specific antigen is organ-specific, meaning to say it does point to problems with the prostate, but it is not disease-specific, meaning to say that you can have a lot of reasons as to why you have an abnormal PSA, and prostate cancer is not the only one. Okay, so what are some possible causes of having an abnormal PSA before you get all too frantic about it? Now, a lot of times, men may have some occasional infection or inflammation of the prostate, and certainly this will result in a higher than normal PSA level. And what about the benign enlargement of the prostate that comes with aging? Now, certainly, as we grow older, it is well known that the prostate enlarges, okay? But it enlarges not due to prostate cancer, it just enlarges due to the natural progression of the prostate as we grow older. And this sometimes can result in a higher than normal PSA level as well. And of course, thirdly, and most importantly, is of course prostate cancer. And certainly this is one condition that we will need to rule out whenever anyone presents to us with an abnormal PSA. So, since PSA is very often the start of everything, should we all be going for a PSA test? Well, PSA screening is actually still very controversial, and it's not just controversial in Singapore, it's controversial all over the world. Okay, at the population level, screening is not beneficial. So you do not hear, there's an established PSA prostate cancer screening program available, because studies have shown that while it helps certain people, it may not help the majority of people at large. So at the national level, no, there is no specific guidelines on whether we should be screening everyone. But certainly, our approach is often one of a risk-adapted approach. So meaning to say, yes, there are certain men who should have a PSA, and usually these men are at a higher risk. So who are the men who should get a PSA done? Men, as I mentioned, older men, more than 50 years old, men with family history, significant family history of prostate cancer, African Americans, and certain men with a higher than usual PSA that is expected of their age. So other than PSA screening or PSA testing, how else can we find out whether you have prostate cancer? So you might experience, for those who have visited a urologist, that we always would like to have a finger in every pie. So we usually will have to examine the prostate, and the only way to examine that prostate is through the rectum. So this is what we call finger examination, the digital rectal examination of the prostate. But how accurate is that? Not very. It is only accurate in about 30%. So it's not the mainstay of how we diagnose. So what other tests are there? You might have heard about another blood test called the Prostate Health Index. And also the latest game changer is actually MRI. So let's talk about PHI first. It is also another simple blood test, usually applicable if your PSA lies between 4 to 10. And what it does is it basically looks at the different isoforms of PSA and tries to generate a different level of suspicion. So there's certain ranges and it correlates with your probability of cancer. But still, at the end of the day, it is not confirmatory. It gives you an idea of your risk, and it actually helps you to guide your decision as to whether to go ahead for further testing. Now, the real game changer in the field of prostate cancer or prostate diagnosis has to be the emergence of multiparametric MRI. Now, I always like to call it the high definition TV, because prostate cancer has eluded us for years. For years, we have not been able to see prostate cancer. There's no way to find out about prostate cancer. Not like lung cancer, you do a CT scan, you see a lump there, you see a nodule there. For prostate cancer, very often, it cannot be seen when you do an ultrasound or when you do a CT scan. But now, with different advances in the MRI, it's provided a high definition, and for the first time, we're able to see prostate cancer. So it is fairly accurate, about 80% accurate. So 80% of the time it's able to tell you whether you have something growing in you. And there are two users, common users for MRI. Because we're able to see where the prostate cancer lies now, we are able to do what we call targeted prostate biopsies. And the second role it plays is for men who have an abnormal PSA and who have had previous negative biopsies. So they really want to know, is it worth it to go for the next biopsy? So in this decision making, MRI certainly has a role. It tells you whether there's a high index of suspicion or whether there's a low index of suspicion. And I'll quickly move on to biopsy of prostate, which really is the crux of prostate cancer diagnosis. Now, in general, there are two methods of biopsying the prostate. We either go through the rectum, what we call transrectal ultrasound guided, and this is actually the most common method since 20, 30 years ago. And there's a newer method of prostate biopsy called transperineal MRI targeted biopsy. So TRUST biopsy is, as mentioned, the most common method, started in the 1980s. It's actually an office-based procedure. We do it in the outpatient setting. We'll give some local anesthesia. But the real Achilles problem, Achilles heel of this biopsy is the risk of infection. Now you understand that the needle actually traverses the rectum, and the rectum is actually a very dirty place in our body because of all the fecal bacteria and things like that. So it really doesn't make sense that we want to go from a dirty area to a clean area. So something has to give. And therefore, there's a paradigm shift now in terms of prostate biopsy. We are refining how we diagnose prostate cancer. So because of the severe infections, we are actually going through a different route now. We are actually going through the skin between the scrotum and the anus. Now, skin is easily sterilizable. So this has actually revolutionized prostate biopsies. It has reduced the rates of infections to almost nothing. All right. Now, what about the role of MRI in prostate biopsy? How can we utilize that information? Now, in this modern age of prostate biopsy, it's not just a numbers game. You know, I want to biopsy 20, 30 cores, or go up to 60 cores just to find that cancer. Now, because the more needle cores that you take from the prostate, it actually causes more risk of problems, okay? It's like bleeding and things like that. So we want to be more accurate but not more kiasu, all right, what we say. So the MRI actually helps in this sense, okay? Because it tells us where to focus on, where the lesion is placed, we can actually target these lesions and do what we call targeted biopsy. And there's very robust evidence to show that this form of biopsy, what we call MRI targeted biopsy, performs much better than the conventional thrust biopsy in terms of detecting prostate cancer. Okay, in the interest of time, I'm just going to fly through this. So lastly, because we're able to find out where the prostate cancer is, this has also paved the way for a different kind of prostate cancer treatment. So in the past, you find cancer, you have to remove the whole prostate. But because we're able to localize the cancer now, we can do what we call targeted therapy or precision treatment of these prostate cancers. So again, I'm just going to show you a quick video on how the whole process starts off.
Anatomic T2 weighted imaging with functional data. A radiologist then reviews the MRI sequences and marks out suspicious lesions using a user-friendly interface, a process which typically takes about 15 minutes. Each lesion is accorded a PIRADS, which stands for Prostate Imaging Reporting and Data System score. This mapping data is then saved in digital imaging and communications in medicine, otherwise known as DICOM format, to be utilized by the Mona Lisa on the day of biopsy.
So this is what happens during the day of biopsy. So we actually utilize the MRI information, and we actually fuse it together with the ultrasound 3D model of the prostate. And for the first time, we can see where exactly in the prostate lies the prostate tumor. So we can actually do very targeted calls of this, and this has actually increased our chance of finding prostate cancer with just one shot. I think we'll probably quickly move on to the results of this. Again, just some studies that have been that we've been doing from Singapore General Hospital. We have actually showed that at least a quarter of patients had underdiagnosed prostate cancer. And actually targeted biopsy is actually more efficacious than a blind biopsy in detecting significant cancer. So in summary, I'd like to end off with this slide. Just a quick recap of what we've covered. Age and family history are very important risk factors, and unfortunately that just gives us our risk profile, but it doesn't help us in changing things. Unfortunately, there's a lot of evidence on drugs, certain drugs or food-wise, but there isn't actually very robust data. But again, let me just highlight, healthy living is always good. Early prostate cancer has no symptoms, and a lot of times the urinary symptoms that men have are more likely due to concomitant benign enlargement of the prostate, which is a separate problem altogether. PSA screening is only advised in men at risk, and we've talked about the risk factors. Diagnosis has to be confirmed with a prostate biopsy. And in this 21st century, a transperineal MRI targeted biopsy offers the best accuracy in finding out about prostate cancer. So with that, I'd like to end my lecture. Thank you.